Hey everyone, hello, how are you today? I am Susan Kaufman. I'm here for Attitude's weekly ADHD Experts broadcast. Today we have Laurie Dupar, a nurse practitioner, mental health professional, psychiatric mental health nurse practitioner, in fact, talking to us about a really important topic, formulations and delivery options for ADHD medication. In the past, the treatment of ADHD was largely limited to short-acting pills. But there's now today a very diverse range of ADHD treatment formulations and delivery systems available. So Laurie Dupar will be telling us in easy to understand language the various options that are available today, such things like how they're formulated and administered, which FDA approved treatments you can swallow or sprinkle or stick to your skin. New FDA-approved treatment options that are not medications, which ADHD medications work quickly, which ones last longer, and when you can take them at night, how ADHD medications work and what might be right for you. So this is an important topic and information that, frankly, is hard to find elsewhere. So we're extremely happy to have Laurie Dupar here today. She is, as I said, a senior certified ADHD coach, a trained psychiatric nurse, and founder of the International ADHD Coach Training Center. She specializes in working with clients who have been diagnosed with ADHD and want to understand how their brain works, how to minimize their challenges, and how to get things done. For more information about Laurie's programs, she'll tell you more about this. You can visit Coaching for ADHD or iactcenter.com. And she is a wonderful resource to Attitude. We're grateful, very much grateful for her time. I'm going to tell you a little bit now about how our webinar system works. You'll be entering your questions in the Ask a Question section. You may download her slides now in the Download Webinar Slides section of the Event Resource tab. And if you have any audio questions, it's really important that you close out any open browsers and preferably use a wired internet connection. As some of you know, we are now, for the first time this week, we are offering an automatic certificate of attendance. This is important information. For those of you who would like a certificate of attendance, you will need to wait until the very end of the webinar when you'll see a survey pop up on your screen with a few questions, 3 questions to be precise, about the webinar that you just listened to. Take that survey, press enter, and then wait until the webinar closes before closing out. You'll receive an emailed survey link shortly thereafter. So, and if you have any problems, email us at customerservice@attitudemag.com. So with that, let me turn it over to Laurie with our thanks, as always, for everything she does for all of us at Attitude.
Well, hello, everyone. Thank you, Susan. That was awesome. I'm super excited about being here. And I apologize if anybody were in the background, anyone's hearing the train honk or the honk of a train. I've moved in the last several months and live in a beautiful area in the very far north, the Pacific Northwest, and occasionally trains go by here. So it's an amazing sound, and hopefully it won't get in the way of our time together today. I'm so excited to be invited back to speak with all of you and to be on Attitude. I'm a huge fan of Attitude, huge resource for all of us here in the ADHD community. And I love the topic it was a challenge topic that they actually gave me, I feel like. And I'm hoping that I do it justice in the next 30 minutes here. The first slide that you're probably noticing, or that I'm going to pull up for you here, is one that maybe looks pretty, but the reason that I wanted to put it here was as a way to sort of start us out on talking about ADHD medication. This is actually a guide that I put together for myself, even though this is my expertise, understanding medication, understanding the neurobiology of the brain, having a just innate curiosity and familiarization with the psychopharmacology of treating ADHD. I need something that helps me keep track of all the ins and outs. So at the end of the at the end of our time together today, at the end of the webcast, I'm going to tell you how you can get a copy of this. I felt that was only fair since it's something that I use and I know how helpful it is in my day-to-day work with individuals, and I'm going to be able to give it to you. So one of the interesting things about ADHD medications I find, especially having a broad understanding of mental health treatment in general, is the difference in the numbers of medications that are available, or that I'm pausing here because I want to say medications, but now we have additional treatment options. So if I slip once in a while, I hope you'll forgive me. But the medications, the number of medications available to treat ADHD are quite a bit smaller than those to treat other, very common, I guess, mental health conditions. We have about 27 to 28 medications to treat depression, and there's only about 13 medications that are approved by the FDA to treat ADHD. And even though there's only 13, it took me to create this, what I call ADHD medication comparison guide, in order to keep track of those. And by the way, there's a front and a back of it that's completely full, and I've color coordinated it depending on the different medication categories. But even with just 13, my guess is one of the reasons that you're on the call here is because it's been either hard to find a medication that works for you, you're interested in the way that the different medications work, or what are the different options out there. And what I find from a practical level, and I'm working with clients, especially for the last 17 years, we're focusing on working with ADHD, is that it's hard to find the right medication at the right dose and the right timing, despite the fact that there's really relatively limited number of medications that are approved to treat ADHD. So I just want to sort of set that stage, recognizing that this can be, that I understand the challenge out there. I understand the challenge of being able to find the right fit for you. And I hope that this talk will be able to provide some of that context for you to make choices that work for you. My introduction into ADHD medication wasn't even when I started working as a nurse practitioner. It was actually when my son was diagnosed with ADHD. And like many of you, I realized even though I'd had the training, I didn't really understand the medications. So it was from that point on that I really made a very dedicated effort, not only be able to understand ADHD medications for my own family or for the clients that I work with, but because I've realized that this is something that is not, the information, our accurate information is not something that's easy to get a hold of. And I want you to have that so you can make choices that work for you. As Susan said, we are going to be talking in the next 30 minutes about medications that are approved, or I should say medications and treatments that are approved, how they're administered, how they're formulated. That's kind of an interesting thing to talk about, how they're formulated. What's the difference? Why are some I can take and they work fairly quickly, and other ones I can even take at night and it doesn't start working until the morning? So we're going to talk also about when to take medications and how long that they last. And as I mentioned, this is hopefully to give you information that helps you make decisions that are either right for you or a loved one, or even apply to your professional practice. Whatever it is your intent to take from this particular webcast today. So I realize I have 30 minutes, and what I'm going to be doing here is sort of doing a bird's eye view of what makes ADHD medications work differently. And I want you to know that there's other options for you that I have available for you to be able to see some of this information in more detail. But I just want to make sure that you recognize because of the time, we're going to be looking at this sort of in a bird's eye view, looking at all the different pieces. And if you want to know information, ask questions, as Susan mentioned, and I'll be talking about some of the other options that are available as well towards the end of the webcast here. So what makes ADHD medications work differently? There's multiple things, and this is why with only 13 medications, it can be so difficult to find that one that works for you. And what makes them different is what they target, what neurotransmitter they're actually activating when depending on the medication, the active ingredient in the medication, which is different than sort of the neuron that they actually address, but it's actually the active ingredient that they target, how it's formulated. And I like to think about things being formulated and how they're packaged. I'm a gift giver in my real life. It's one of the things I love the most. And how things are wrapped or how they're packaged is how I understand the concept of formulated, and how we take them, how we introduce them to our body, whether it's like a patch or a sticker that is absorbed through the skin, whether it's something we can swallow, whether it's something that we put on our skin, is one of the other differences that happens with ADHD medications. And then even with all of that, that's sort of the science part of it, right? The part that's really, really controlled, the part that's engineered and the pharmaceutical companies have got down to a science, is our own unique physiology. And I think that's one of the things that we don't have as much control over and can make things a little frustrating for us trying to find that right fit for us. But it's helpful to know, what is it that makes it work so differently? So that's what we're going to be talking about, how your unique physiology makes a difference as well. So let's talk and start first with this topic of the neurotransmitters, or what these medications are targeting. For the most part, these medications are targeting the neurotransmitters in our brain. And there's really three of them that, if we look overall at the ADHD medications that these are targeting, dopamine being one of them, serotonin being another, and norepinephrine, or in some parts of the world we call that noradrenaline, is the other one. Overall, these are the targets that the medications that you take are addressing in one way or the other. They are either increasing the efficacy of, or the amount of those particular neurotransmitters available in your brain, or the amount or the efficiency of these particular neurotransmitters or brain. But the target tends to be these particular neurotransmitters. And because now we're going to talk about a new treatment for ADHD that is not a medication, but actually a device, it still is targeting the neurons in the brain, the nerves and the neurons that are in the brain. We're going to be talking about this device. It's called an eTNS in just a bit. But these, in a nutshell, are what the medications are targeting. To really understand, I think, I don't want to be talking about medications or neurons or targets without having an opportunity to just explain very briefly about how they actually work. When we're talking about targeting, what exactly are we looking at? And what's important to understand about how ADHD medications work, you don't have to have a degree as a neurobiologist or as a neurologist, but to understand a few things about the brain is helpful. And one of the things that is helpful to know, and if you're following along on the sides, you'll see a slide that has sort of a picture of a head and a neuron, and also a breakdown of that neuron. But what's important to know is how neurotransmitters are made in the brain and how they travel through the brain. And it makes sense when we understand that there are different pathways, especially for the neurotransmitter dopamine, which we know is really one of the primary neurotransmitter that is in short supply for people with ADHD, that there are multiple ways that or multiple pathways that the dopamine needs to get to in the brain. And with people with ADHD, for whatever reason, it's not activating all of those different pathways. What's interesting is that for the most part, this dopamine is made in this middle part of the brain, and it then needs to get to not only the frontal lobe of the brain, but it also needs to travel around to the outside of the brain, to the cortex of the brain. There's different dopamine has different functions in those part of the brain, which accounts for what we think is why there's so many differences in people with ADHD and why their symptoms are different. But what's important to understand is how does it get from that mid part of the brain through some of those pathways? And it does that by traveling along the neurons, which are the cells of the brain. And neurons are really sort of uncannily similar to what looks like a tree, right? If you sort of take a big tree and stand it on end, you've got the roots, you've got the trunk, and then you've got the branches. And that to me is a great way of understanding how a neuron looks in the brain. And these are set basically end to end. And what happens is that they're set end to end, but they don't actually touch or connect. And where the real activity happens in the brain and in these neurons is actually where they come together, but there's a space between that. And we call that the synapse. And when we're talking about what these medications are targeting, when they're targeting the neurotransmitters, dopamine or norepinephrine or serotonin, there are these receptors that are at the ends of these neurons that are targeted by the ADHD medication. And when they target the medication, they either help more of that release into the synapse so that on the other side, the other neuron can take that up and start to transfer it to the next neuron so that it travels throughout the brain. Or it actually might block one of the, what's called a reuptake part of the neuron so that it stays in the synapse for longer periods of time, and there's more possibility of the next neuron picking it up and transferring it through these pathways throughout the brain, right? So I want to just very briefly explain, that's what we're talking about when we're targeting. For me, it didn't help when someone said, well, it's targeting the dopamine. I'm like, well, what does that really mean? So I'm hoping understanding how there are these different pathways in the brain that the dopamine needs to activate. And for whatever reason, there tends to be a short supply or it's not working efficiently in our brain, these different neurotransmitters. And what these medications are doing are making it possible by working at the ends of these neurotransmitters where they come together in that synapse to either increase the amount of neurotransmitter that's released so it can be more active, or blocking a reuptake so that it has to stay in the synapse and by therefore creating more activity in the brain as well. So hopefully that was helpful. If you didn't know that, you know more now than most people do about ADHD medications work. We talked about what they're targeting, about the neurotransmitters. Now I want to talk about the active ingredients. I mentioned at the beginning of this talk that there are really only 13 medications that are FDA approved. And even when we look at those 13 medications, and we break them down, there are very few active ingredients or very few different active ingredients in ADHD medications. And in fact, we can just limit it down to really two categories. One is called the stimulant category of medications. And it's called a stimulant because what it's doing, it is increasing or stimulating the production of the neurotransmitters. I think that's something that's oftentimes misunderstood about what a stimulant is. We think that it's to stimulate the body or something like that. And for people who don't have ADHD, that might be the effect that they have when they take a stimulant. But what it's really stimulating is the neurotransmitter to increase the amount of neurotransmitter that's available in the brain so it can travel through those pathways that I just described for you. The other category is non-stimulants. And these include medications like Strattera, Wellbutrin, Tenex, Clonidine, and I've categorized this new sort of external device that is a nerve stimulator in this non-stimulant category because it doesn't necessarily target or address the neurotransmitters the same way that the stimulants do. The stimulants also can be broken down into really two major categories. For the most part, they are either ones that have an active ingredient that's a methylphenidate, and I've included some examples on the slides. Those include things like Ritalin, Concerta, Daytrana, or Quilivant. Those are methylphenidate. That's the active ingredient in those. Or they are some derivative or combination of an amphetamine. And examples of the stimulant category, their amphetamine stimulant category, is Dexedrine, Adderall, and Vyvanse. This may not be a inclusive list depending on where you are listening in from the world, and I apologize to my neighbors who I may not be including some of the medications or the names of the medications that are familiar to you. But for the most part, when we're talking about the FDA, I'm talking about medications that we're familiar with here in the US, and typically the name has been changed in other parts of the world. But they also fall into these categories, whether they're a stimulant or their active ingredient being a stimulant like methylphenidate or amphetamines, or a non-stimulant. And the fact is, even with the stimulant medications, that people do respond differently to those. And that can be somewhat surprising to people. They do work a little bit differently at the neurons in the synapse. They do slightly different things. One of the medications tends to block the reuptake so that more of the neurotransmitter is available in the synapse to be used. And the other one, the amphetamine specifically, tends to activate the neuron so it releases more of the neurotransmitter dopamine into the synaptic space. And people tend to respond better to one or the other, meaning that they tend to have better positive benefits from either a methylphenidate or amphetamine, or they have less side effects with one or the other. And it's hard to know which one that's going to be until you've either tried them. One of the things that your prescriber oftentimes will do is ask you if you have anybody that's related to you biologically that is taking one of these medications. And the reason that they do that is because oftentimes, or what we know, I should say, is that ADHD is genetic. So it makes sense that if we have somebody who is taking an ADHD medication, has had a positive response, meaning a good impact on their focus or their attention, but not experience a lot of negative side effects with it, it might be a medication or a stimulant category for you to start with and see how it works. It's a starting place. It may not be the end place. When we're talking about the non-stimulants, these are the approved medications that activate the other neurotransmitters I mentioned, specifically the serotonin and the norepinephrine. And they do that in different combinations. Okay, they do that in different combinations. And again, even some people respond better to a non-stimulant medication than they do to a stimulant, simply because of the way that their ADHD is showing up for them. Or maybe it's a combination of some other coexisting conditions that are also accompanying the ADHD. That this is something that a lot of people often want to try to see because they want to try, they may have a belief that the non-stimulant is somehow less impactful than the stimulant medication. And my experience has been that it really is very, very personal. It's personal as to which one works better for you. And it all has to do with being able to identify what particular symptoms you're targeting, and then having a way of keeping track of those as you work with your prescriber in order to find out which medication gives you the most positive benefits and which one has the least side effects. So an example would be, for some people, Wellbutrin works great for them. Some people take Wellbutrin because it activates norepinephrine and the serotonin, and that's a great combination for them. But for other people, when they take that medication, it actually creates quite a bit of anxiety for them, and so it's not a good choice for them. Strattera is another good example where for some people, because it also targets more of the norepinephrine and also the serotonin, it's a great option for them. And it seems to work if they have more an emotional component to their ADHD. However, for some people, the side effects of Strattera can be quite discouraging. There's can be a lot of nausea, a lot of constipation, those types of drowsiness, those kinds of side effects with it. But when we're looking at active ingredients, what I'm hoping you take away from this is that we're really looking at two categories of medication, stimulants, non-stimulants. We're looking at what they target, meaning serotonin, norepinephrine or dopamine. And when we're looking at stimulants, what it's stimulating is the dopamine in the brain. And there's two different active ingredients. That's all we have, two different active ingredients that do that in slightly different ways. And those active ingredients are the methylphenidate and the amphetamine. Let's move on and talk. So I mentioned to you that, or we've talked about how it's targeted, what the active ingredient is. What we're going to talk about here is how it is formulated. And what I mean by this is that this is the best example I have for this is how it is packaged. And what makes ADHD medications have the variability that they do is, I actually think, in how they are formulated. We have lots of ways that science has been able to repackage these active ingredients to help it fit more specifically for what people need. And that has really been where new ADHD medications have gone, is how to repackage that. As our science has gotten more advanced in how to administer medications or formulate them, that's where the differences and changes go. And sometimes that makes a huge difference. The ability to formulate medications different has made all the difference from when all we had was a short-acting Ritalin, and students or even adults had to remember to take their medications every 4 hours with ADHD, versus now perhaps options that have the medications lasting much longer. And in some cases, 12 to 16 hours. That was unheard of. I remember when my son was diagnosed, he was having to go to the nurse's office every lunch hour to get his next dose of medications. Those short-acting medications are still an option. They work well for a lot of people, depending on how they're wanting to manage their ADHD. But it's in this reformulation or this repackaging of this medication that we really have gained a lot of variability in being able to treat ADHD. And those variabilities include everything from a transdermal type of administration. For instance, the Daytrana patch is one of those. The medication is absorbed into the skin. Some of them now are liquid. There's a lot of people who struggle with taking a pill form. So yay for liquid administration of medication. As I mentioned, we still have our short-acting medications out there that are tried and true mainstay of ADHD medication treatment. And we have these amazing medications that have a variety of different release formulas that will allow them to be long-acting. We also have some medications that are now in more of a pill form or a tablet form, and some that are also in a capsule form, in a gel, two gel capsules put together with beads inside of that. We also have now the ability to add in here generic different medications formulated, again, a little bit differently than our brand name medications. And we have these weird ways of medications being packaged or released. And I've included in this side of how it's formulated, and I'll explain those in a little bit, what we call OROS or SODOS. And we're going to talk about these because these apply to medications such as Concerta or methylphenidate or Ritalin LA, how they are administered and why you can take a medication in the morning and it's still active in the evening. And it's not because the active ingredient has changed, it's because how it's formulated, how it's being packaged. Right. So the latest one, which I'm really excited to talk about here because it's only been available since April, is electrical stimulation. It's formulated as electrical stimulation applied to your trigeminal nerve, and that activates, travels and activates different neurons and places in the brain. So let's talk about some of these sort of fun and new formulations, and just to talk about different examples so that you have some information. Again, not a lot of people have out there about how these are formulated and why they work the way that they do. So I mentioned to you there is this formulated system. You can tell why there's an acronym for it, OROS, because to say every time osmotically controlled release oral delivery system is just a mouthful. But this is an example of Concerta. Concerta was one of the first medications. It's a methylphenidate. I call it a remake or reformulation of Ritalin. It's methylphenidate just like Ritalin is, but it's how it's packaged. And they were able to create this kind of packaging with this medication to release over long term using this particular delivery system. And basically, when you take a medication that has this kind of formulation or delivery system, it actually, when you first take it, there's a shell on the outside that has medication in it, and it dissolves. And there are actually 3 inner compartments in these medications, which release at different points based on one of the chambers actually absorbing fluid from the intestine. Hopefully that doesn't sound too yucky for people, but it's like if you have a dry sponge, I guess, and as water seeps into that, it expands a little bit. That's basically what they call this push compartment. So as that expands, it actually pushes the next dose of medication through what's really a tiny sort of hole at the end of the medication, the Concerta, and that is what results as extending it over time. So you have that immediate release from that outer shell that has medication in it, and then as it travels through the gut, and the push compartment, which, like I said, you can think of it like a sponge, absorbs fluid from the intestine, it actually pushes the next doses of medication out. So FYI, like I said, that's I think a really interesting understanding of what happens in Concerta. Another type of delivery system is what is called SOTUS. I like the word SOTUS, but it's kind of confusing when you go to Google it because a lot of pop and carbonated beverage show up. But what we're talking about here is what's called Spheroidal oral drug absorption system. Again, reason we call it SOTUS because it's a very big mouthful. Similar to a bit like the Concerta is released. This is actually how Ritalin LA is released. So they're different. Even though they are both methylphenidate active ingredients, they're packaged differently. And this medication, the way that I think about it, may not be necessarily too technical, but I think about it as like one of those big jawbreakers I used to eat when I was little, and how if you kind of went through the layers, there were these different colors that showed up, and at the middle where there's like this hard core of sugar that you had. So these SOTUS medications like Ritalin LA are formulated in this particular matter. They, again, as they absorb or as they release, as they go through your intestines, they release different layers of medication, and that's how they are able to have that sustained action. One of the other things that I wanted to talk about, and I didn't necessarily include it in, let's see, make sure if I did this, include it in, sorry everyone. I get excited when I talk about these medications. So I want to now talk about, if we're talking about how things are formulated and released or packaged, I want to make sure that I spend a few minutes talking about this new device. It's called an eTNS. Again, there's a reason it's called an eTNS. It's because to say Monarch external trigeminal nerve stimulation system is a big mouthful. eTNS is sort of a fun little word to say, but it's really exciting because up until this point, we have had very minimal options when it comes to the formulation or administration of treatment for ADHD. And it's really, for the majority, medically anyway, it's been as a pharmaceutical agent. To have something that's been approved by the FDA that isn't a pharmaceutical product is really exciting. And in fact, this particular type of technology has been around for quite a while, even though it wasn't approved for use of ADHD up until I think it was in April of this last year. But this has been something that this technology has been around for quite a while. It has been used to help people with other types of brain, I guess you could say, disorders, including things like migraines or epilepsy. And I think in an effort probably to see what else could this tool do or this device do, there was a study that was done that included, I think, about 60 or so children with ADHD. And what they did is they gave half of them this particular device. The other half had a device, even though it wasn't specifically doing what this eTNS device did. And then they monitored and tested some of their responses over a period of about 4 weeks. And they found that over that particular period of time, there was a significant, at least statistically significant, difference in the research when students were using this particular device. So I think it has a lot of promise, and I think it's really going to be very popular, considering that a lot of people maybe don't want to take a medication, or they want to try something that isn't quite as invasive as an ADHD medication, but something that is showing progress in how it works. I want to say that with this particular medication, it does require a prescription. There's a cost involved with it again, and that's going to be super important for you to know if you're talking to your provider about that. Finally, as we get down here, I've created a slide for you that is what I call the swallow, sprinkle, or stick slide. I'm not going to go through each and every one of those, but hopefully this is a way for you to appreciate how different medications can be taken. I think it's fairly accurate. This information, again, is also on the ADHD comparison guide that you can have access to at the end of the webcast here. But for the most part, you can swallow just about everything. There are a couple that you want to make sure that that do go on your skin, like the Daytrana patch. And if you're taking clonidine, or it's one of them that can also come in the patch form, being able to sprinkle medications on food is a really important option, I know, for a lot of parents or individuals who struggle with taking a pill form. So take a look at that if you know that that fits for you. There are only a few that you can actually chew. There are some you can actually drink, which is, again, a nice option for those who are challenged with taking a pill form. But just, again, some information for you so that you have it all in one place. And before we end this part of the webcast today, I do want to quickly mention how your physiology does impact this. We know that people with ADHD, there is definitely some similarities, but there are a lot of differences. What those differences are for you is what's going to make each of these treatments work differently for you. So when you're asking perhaps somebody, which medication do you use and how does it work for you? It's sort of a question that's not necessarily going to be helpful, because what you don't know about them is what their individual physiology is like, what their level of neurotransmitters are, what pathways in their brain may be more impacted by these neurotransmitters than yours. All right. So our physiology of our brain is different. Another really important physiology consideration that we need to realize is how our gut works. There's doing a lot of research on the connection between the brain and the gut. But our gut can change so much. A lot of these medications, especially those that are long acting, are dependent on how our gut works, what the pH is, how fast our metabolism is. And those, again, are things that may or may not impact the efficacy of certain medications for you. And there's a lot of things that can impact how our gut, depending on how old you are, what food you eat, how you sit, how much exercise you get, all of that. So it's a consideration that I think we need to make sure that when we're comparing medications, that we're also recognizing it's just not the medication. That's the science of it, the engineering of it. That is a consistent piece of it. But we are human beings and we have variability. And what works for one person, or the type or the dose, may not work for someone else. Finally, I just want to give you some quick information that shows that, again, highlights what are short acting and long acting. Basically, if it's long acting, it has one of those acronyms after it, something like XR or LA. Why they couldn't be consistent, I don't know. It makes it very confusing. And again, I have a guide on the ADHD comparison guide that gives you sort of a cheat list as to how to interpret those. Basically, though, what you're going to find, if it says LA, XR, or SR, even sustained release, it's going to be long acting. It's one that's going to work over time. Another question I get a lot, and I'm again not going to go through every single one, but when do I take this? I find that some people don't realize that there are some medications that they can take multiple times during the day. So I've included examples of those that can be taken multiple times during the day. And also there are some that you can take at night. One of the most interesting, I think, is this new medication that came out, I think, last fall, that's called Jornay. Again, the active ingredient is not new, it's methylphenidate, but how it's packaged, and they're very, very secretive on how this is done, so I actually wasn't able to get much details about it. But basically how Jornay works, or what they're addressing, is you can take this medication at night. It has a delayed release so that it won't for, I think, 8 or 10 hours. And so the hope is that when you wake up, the medication is active in your system. Again, the active ingredient isn't different. It's methylphenidate, but the formulation is how it's formulated. And like I said, they're pretty sneaky about how they make this. It's sort of proprietary, so it's hard to find it right now. Strattera is also something a lot of people I find don't realize they can take at night. For people who have the sedative effect or even the nausea, the upset stomach with Strattera, taking it at night may be an option for you. So I wanted to make sure I just included those for you so that you had that in your slides as a reference. And then finally, I want to make sure that I thank Attitude for inviting me on again. I hope that you've gotten information that is useful for you today. That's always my goal. I also want you to know how you can get a hold of this ADHD medication comparison chart that I put together. You can get it by going to my coach training program at ixcenter.com/medguide and access your own copy of that. And I look forward to the questions and that Susan.
Thank you, Laurie.
Yep.
So that was a great overview. I mean, and really, you brought great order to something that's quite complex. You know, I thought it was very helpful to start with the 3 distinctions between the two, between stimulant and non-stimulant, and then within stimulant between methylphenidate and Adderall, and then to go from there to the various delivery systems. So I hope everyone had some clarity on that, because I know it can be pretty confusing. The 2 new medications, there are questions raised about both of them. One is Jornay, and you mentioned a bit about that. And the other one is something called Adhansia, ADHANSIA.
Right.
And so I think on the Jornay side, as you mentioned, it's taken at night. It starts to work in the morning.
It's formulated in a release. My guess is it's very similar to the way that either the Concerta or Ritalin LA are formulated. It's just a thicker outer coat. Now, that's my very limited experience with any kind of engineering, any kind of pharmaceuticals. But like I said, they're really tight-lipped about how it works. But what they're addressing is that how can we wake up with this medication in our system? And even though it's the same active ingredient, methylphenidate, it's something, if it's easier for people to take it at night, maybe that's a good option for them. Yeah.
Yeah, I think we hear a lot from attitude readers that those early morning hours are really tough because there's no medication in either the adult or the child system for some time.
Yeah.
And what about that? How long does it take? Do medications vary in terms of how quickly they become active?
Yes.
In the system?
Well, how quickly they're released, and that has to do with the formulation. Some of them, you take it and it's active right away. It still has to be swallowed and be activated or metabolized by your system, by the stomach fluids, by the pH in the duodenum. All of that stuff gets a little complicated there, but that's what actually breaks down the medications so that they can be metabolized through the liver. And how fast they do that, or the barriers that are created by the way that they're formulated or packaged, determines how fast that happens and how long that will last.
Okay.
Does that help?
Yes. So, I mean, I think what I'm hearing a lot and hearing from both from you and from the listeners is that it really is a trial and error
it is
process, because your own body and your own metabolism affects possibly how quickly it begins to function for you and how long it lasts.
Yeah. Yeah. Thank you for saying that. And I really appreciate whoever made that point, because what can happen is that there are some guidelines, or there are that if you read about the medication, it says, gosh, it's supposed to last 6 to 8 hours, and I'm finding it only lasts me 4 hours. I want you to really trust yourself. I want you to realize that absolutely could be possible. Or maybe a medication that, someone says, well, gosh, it only worked 6 hours for me. You're noticing it lasts 10 hours for you. And you have a particular way of noticing that could be very true. And it all has to do with that physiological difference for each of us.
Right. So fascinating, right? Yeah. Believe it or not, there are people who would like, this surprises me. So maybe it's not a surprising question. They would like to try both an amphetamine and a methylphenidate at the same time. Take a low dose of both. Or is that done in your experience?
You know what? Not often. Sometimes I see it, but there's a reason for it. I think it makes sense. It's like, if they both work differently, right? Like, why can't we take them both? Why don't they put them together?
Right.
I've asked the same question. I think it's very smart that people are asking that. So the reason is because it's sort of, if we look at that part about the neurotransmitter and in the synapse, it seems for some reason, first off, they're both controlled substances, so it's going to be hard to put them together if they, without a really good reason to do it. But what happens neurobiologically, and this is again where the physiological difference are, is that there seem to be some people who produce enough dopamine, it just doesn't stay in the synapse long enough. Those are people that tend to benefit from methylphenidate. They will be the ones that if you give them something that's an amphetamine, they will feel agitated and activated because they're already producing enough. It's already being released. What they need is some way to keep it active in the system or to help it transfer on to the next neurons. There are other people that simply don't, for whatever reason, release enough dopamine into the synaptic space. And so for them, a different amphetamine medication would work for them. There's no way for us to know that by any kind of a test, by any kind of, even the genetic testing that's gone out there to tell you that. The best way to do this is to try the different medications individually, or try the different medications and active ingredients individually and see what response you get with it. The best physicians that I know and the best prescribers that I know actually understand that. When we start, if somebody is a better responder, for instance, to the methylphenidate, you don't want to be giving them an amphetamine because it's not going to be as comfortable for them. It's going to feel uncomfortable in their skin. The opposite is true if they are better responders to the amphetamine. They're going to feel uncomfortable and it's not going to be as effective for them. And there might be more side effects if they take a methylphenidate. So even though it makes sense, why can't we just combine these? That makes a lot of sense. Apparently it doesn't work.
It just doesn't reflect how our bodies respond.
No, doesn't reflect how our bodies respond.
Right.
Exactly.
So sort of the next step in that question was asked, which is, if someone has negative side effects from one of the methylphenidate medications, would they have the same side effects from all the methylphenidates? Or would that mean that they should go to an amphetamine?
Yeah, not necessarily. And I know that may not be the best answer to that question, but not necessarily, because part of the formulation is not just how it's packaged, but what goes in the packaging. It's sort of like, if you get an Amazon box, sometimes they have the popcorn in it, and sometimes it's got the air bubbles in it. How people sometimes have different reactions to the filler of the formulated medications. So that can make a difference. It can also make a difference. What they may not also realize is how their body responds to those different fillers, right? So it doesn't necessarily mean that it's the wrong category of medication or the wrong active ingredients. One of the ways that I think is really helpful for people to determine, and do I respond better as far as my ADHD symptoms with methylphenidate or the amphetamine, is to try the quick acting dose of those particular medications. Couple reasons for that. If it's not the right formulation for you or the right active ingredient for you, it's a fairly in and out quick experience in your body. The other is you will know fairly quickly whether or not it's the right one or the wrong one also, and you will be able to compare them that way. And you're not messing with a lot of other fillers.
Okay, so that's a helpful suggestion. So and I think many people are struggling with how to work their way to the right medication. So what you're suggesting is try in a short acting dose and then if that is a problem, move on to a different medication.
Yeah.
Right.
A lot of what makes the ADHD medication so different, like I said, is not the active ingredient, it's how it's formulated. And the formulation is really, it opens up so many variables. The filler in it, the individual, especially the individual gastrointestinal tract physiology in that. So you may not do well, for instance, with short-acting Ritalin because it goes up and down quickly, and you might have what we call sort of that rebound with it, but you may do better with Concerta. Some people don't like Concerta, even though it's the same active ingredients, because the way it's released in them feels like it goes up and down throughout the day, but they really like Ritalin LA because for the way it's packaged is different, and it seems to work better for them. So it is worth not only considering the active ingredient, it's why I love doing this presentation here for you, the active ingredient, but the formulation of how it's formulated makes a big difference.
Okay. Do you have any general guidelines, Laurie, when you work with patients about what the steps are to get to the right medication? I know you just said an interesting first step, which is just try a short dose.
Yeah. The first step is actually get to know who your prescriber is, make sure that they understand ADHD, and have worked with other patients like you. If you are, and I actually have a handout, you guys might have access to it. It's called 13 Questions to Ask Your Prescriber, your ADHD medication prescriber.
Yeah, that's a great handout. Yeah, we have that on our website.
And I really think that's important because it's a little bit like, trying to go to a grocery store and wondering why they don't have gasoline there. It's like, they just don't have it. And so you want to find the place that somebody really understands ADHD medications. I understand it might take some work, especially for people to find that, but that's really one of the first steps. Beyond that, what I would hope and what I see works the best for people, and in the roles that I have, I work with people all over the United States, all over the world, actually. So it's interesting, the variety I see of how medications are approached. But I do think the best approach is to try the different active ingredients in a short acting form of the stimulants, or And one of the reasons for doing that is because with the stimulant medication, you know very quickly, within a day, 2 days of taking it, whether or not it's making a difference. And by the way, you're not noticing it doesn't mean it's not working. It might be dose related. You may need a higher dose of it. If for whatever reason you do take those over a certain number of days specifically, and only change one thing at a time, and you are noticed with both of them, the different, whether it's methylphenidate or the amphetamine, of uncomfortable side effects, absolutely try one of the non-stimulants. The reason I don't start with the non-stimulants is because it can take many, many weeks for people to experience the full benefit of it, whereas it takes simply a few hours to at least have a good idea whether or not the stimulant medications are working.
Okay.
Yeah. And remember, you can combine this non-stimulants and the stimulants because they work on different, they work on different, they have different actions. So you can combine those, and many people do, especially like clonidine or guanfacine with one of the stimulant medications, or Strattera and a stimulant medication. They're not, you don't have to keep them separate.
Okay. How do you tell if the dose is too high or too low? That's a common
it's a good question.
Listeners.
Yeah. Too low, maybe you don't notice anything. So sometimes people say, when they say, I tried it and it didn't work, it's important to know that. Some people need a higher dose. Again, this has to do with our physiology, need a higher dose to experience more positive benefits. If you're not noticing anything negative, meaning nothing, not necessarily the wrong medication, it may just need, the dose might need to be increased. And I like to go slow. And again, that's another thing that I encourage people to do, so that we don't want to take any more medication than we have to. That's usually most people's philosophy on this. So just increase it, a little bit each time to see what is the right dose for you, or when you start to notice something different. If it's too high, I actually don't find that too often, but if that's and the reason being is because the goal is to be on the lowest effective dose. But if it feels like it's too high, back it down. If it's a stimulant, you can do that. Talk with your prescriber, absolutely, and see, and talk about your concerns. I think it might be too high. Can we go down and see what it's like at that particular dose for maybe a week? And then really notice and pay attention and take note of what the difference is, and then adjust from there.
I think that, Laurie, that you have a really good, as I remember, a chart for tracking your symptoms.
Yes, I do.
Right?
Yeah, you guys have that as well. Yeah, it's called
is that ADHD on your website as well?
Log. Yep. Yeah. You can get that at the website as well. Yes.
Okay. Yeah, I think that's a super helpful way for people to, give feedback to their practitioner and then tweak the medication. A last comment, because unfortunately we're almost out of time, but I realized that we should have said this up front. A number of people are still thinking that maybe ADHD is different from inattentive ADD. And I just want to clarify that we use the term ADHD now for all forms of attention deficit disorder, including inattentive ADHD. And I think there's nothing Laurie has said, I think, is for one or the other with that. Is that correct?
ADHD is the current medical professional term. ADD was something that was in the 1980s. There's been other words for ADHD, but now the term is, the umbrella term is, the correct medication term is ADHD. From there, what happens is the diagnostician will indicate whether or not that particular person's ADHD is more of an inattentive predominant type, or a impulsive or hyperactive type. One of the things that I think so it's all under the umbrella. Yeah.
Okay. Yeah, I think that's really interesting. It's not that no one's saying that there's not a more inattentive type of ADD there. They're not. They're just using the umbrella term ADHD to clarify that.
Right. So, and I find a lot of people think that they're different medications for if they don't have the hyperactive type, and no. They're not different medications. This is all ADHD. I think misunderstanding oftentimes comes that the hyperactivity is only in a physical hyperactivity. And in fact, most people with ADHD, if they don't have the physical hyperactivity, have a lot of mental hyperactivity or verbal hyperactivity. And we oftentimes can forget that.
Right. Or even finger tapping or other sort of, I've heard of other forms.
Absolutely.
Right? Yeah. So Emma says, wow, so much amazing information, really easy to follow. Thank you for making this so understandable. And I think that we all share that perspective. This was really great. For those of you who would like a certificate of attendance, we're going to launch a survey now. And we would ask you to answer three simple questions and to stay on the webinar until it ends formally. So that you will be counted as having attended the entire webinar and received the certificate via email. Let me talk a bit about the upcoming webinars for Attitude next week, Tuesday, August 6th. We have a great speaker on helping children with ADHD overcome failure, fear, and disappointment. He calls it the gift of grit. It's Brendan Mann, and I think it will be an interesting presentation. And then the Tuesday after that, we're heavily into our Back to School series, a course for teachers and parents about teaching executive functions to kids to use in school and elsewhere. So I hope that you will attend these. All of you should know that this webinar will be available on our website. You can download the slides at any time. You can take it again. And if you want the certificate of attendance, you can also obtain that by following the webinar through the replay page on our website. So let's see, have we had enough time to take the survey? Thank you everyone for attending, and Laurie for making such a complicated, super complicated concept so clear and with so many component parts. And all of you, thanks so much for attending. And if you're not taking the survey, you can sign off, and we'll see you, I hope, soon. And you, Laurie, thank you so much also.
My pleasure. Thank you. Bye, everyone.